So is this discussion going to be in English or both?
I think I have my questions prepared in English, tapi it's up to all of us. If you want to converse both my, English and Malay, completely okay with me.
Okay, sounds good.
Hello.
Okay. Hi.
Hello.
Okay. Cool. Alright, I think everyone is here, so we can start first. I mean, I guess we can start already. So first of all, on behalf of Bagibalik, I'd like to say thank you to the three of our speakers, Puan Anita from Miasa, we have Nordini from Toke, and also Iman as the branding associate from Putra. Thank you so much for willing to spend your Saturday morning with us to just have this quick discussion, and hopefully it'll be like a fruitful one for our fellow viewers here today. So also I just have a question that someone asked if they can ask in Malay. Yes, feel free. We accept both Melayu and also English. So it's just for formality, I'm just asking all the questions in English lah. But any languages is okay. Okay, so I guess for starters, as an introduction, I'll just briefly tell everyone on our live today what is Bagibalik. So we're just all of us at Bagibalik are just a group of like change makers who envisions a world where we want to instill the giving back culture, and we want to achieve that through streetwear. So maybe in that way we can, you know, have more people on board with us, especially the younger people. And also, specifically what we do is that we try to help all the NGOs financially, which is why we sell all the streetwear. And also we want to amplify the social issues also through streetwear. Okay, without further ado, maybe I'll call Puan Anita first. Maybe you can just tell all of our friends here today what is Miasa about, and yeah, anything you'd like to say about Miasa.
Boleh. Alright. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. And a very good afternoon, everyone. Thank you so much to Bagibalik for organizing this session. Alhamdulillah. I'm Juanita, the founder and president of MIASA, which is the Mental Illness Awareness and Support Association. So we are a mental health advocacy and peer support group based in Petaling Jaya. So as much as possible, what our vision is to provide, you know, non-medical, as much as possible, non-medical alternatives for our peers that are struggling. We do provide, you know, help in terms of therapy, you know, clinical assessments, etc. But that can be accessible via clinical settings. So as much as possible, other alternatives, including spiritual therapy, art therapy, expressive dance therapy, peer support, which is a big thing that we do. So we pretty much raise awareness of the importance of mental health and also correct myths on what is mental health conditions, and you know, hopefully to take away the shame out of having this condition and from this discussion, and providing support to people that are struggling, inshallah.
Thank you so much, Puan Anita. That's a very interesting, you know, support group that we have actually locally. So I guess it's good for everyone who doesn't know that, you know, Miasa actually exists, and it's a good platform here today for us to share. And also next, I think I'll call Nordini. Do you want to talk a bit about what Toke is about and what you do there?
Okay. Hi, thank you, Shafika, for the introduction. Hello, everyone. My name is Nordini, and I am the co-founder for Toke Social Enterprise. So we are a social enterprise that partnering Bagibalik.my currently at the moment. So our social enterprise is helping vulnerable groups, young and mothers coming from BPO groups, where to selling food assistance and also agriculture through that. So at the moment, we just had our project World Buffet Ramadan that I will talk more during the question later. And we are currently figuring out on how we can venture more on food and business currently at the moment, because we just had, announcement of MCO. So all my teams and beneficiaries are setting up on how we can amend the business model to help all those needs.
Okay. Thank you so much, Nurdini. That's very nice to know. And then next, I guess we have Iman, the branding associate of Putra Center for Social Studies. Do you want to tell us a bit what Putra does?
Okay, Assalamualaikum. My name's Iman. I'm the branding associate from Putra. So basically, Putra is it's one of the very new youth movements in Malaysia. Currently, we are having initiatives where we try to help out the B40 around Kampung Baru through our hub, and then we also have research going on, especially lately. I think the most recent, we had a community mapping before the MCO on the study of information access, social mobility among the youth of Kampung Baru. So besides that, we also share infographics about current issues and so on. So if you guys are interested, you guys can follow us, and we update weekly on all these infos that we can share with you guys.
Okay, thank you, Iman. Okay, so thank you, everyone. I guess just briefly, I would like to tell everyone here that all three NGOs who are here as speakers today are the partnering NGOs with Bagibalik MY, all for all for our different pledges. For example, for Miasa today, this is why we were having this discussion today, because at the moment our current collection is based on our Bagi Dengar pledge. So that pledge will be about advocating for mental health awareness, and that's why one of the initiatives today is also having this discussion on whether the MCO 3.0 is affecting our mental health or not. So I guess without further ado, maybe we'll just start the ball rolling, and I'll ask some questions, and it should be a very casual conversation. Just Puan Anita can speak on behalf of Miasa, maybe Iman on behalf of some youth, because since she's in a youth-led organization, and then also maybe Nurdini will kind of be talking about how unemployment is raising within the people in her focus group for her social enterprise. Okay, cool. So I guess just a very general one. So according to the Ministry of Health report in 2016, so the scale for people with mental health problem has been tipped well before COVID-19. So that was already tipped well before. However, do you think that the pandemic has worsened it? Any takes first? Anyone?
I'm okay to go first. Oh, okay, sure.
Okay, I give Puan Anita first, and then Nurdini can add on anything.
Right, thank you very much. I think that's a very important question. The pandemic of COVID-19 has definitely worsened the mental health conditions of individuals in Malaysia and across the globe. So, the data is out, numbers are out, so we know this is absolutely true. And I think this is not something new, because we have seen, and I say this a lot, so I apologize if I am repeating this point, but throughout pandemics like the Spanish flu or epidemics of SARS, for example, throughout many wars, like what we're currently seeing with what is currently happening in Palestine, the mental health impact towards children in Gaza, or during the, Great Irish Famine, or even during the Great Depression of the 1930s, which we're not talking about it as well. It had a tremendous social and psychological impact. So people have fallen into depression, having anxiety, having PTSD, suicide risks have increased. People have resorted to harmful coping mechanisms, be it alcohol, be it drugs, self-harming, etc. And this includes the measures of the lockdown as well, which leads to, for example, increase in domestic violence, pornography and such. So what more the impact amongst frontliners. So we've got to also remember that the frontliners are our armor, and they are impacted the most, really. So this is something that we've seen throughout, and I think the most recent press conference that was conducted by our current health minister YB Adham, together with Ministry of Health, which he revealed that from 1st of January to 21st of May, they have received 101,000 calls via this helplines of the psychosocial line of COVID-19, and Talian Kasi, including Jakim's helpline, 91.2%, guys, let me tell you, called to seek emotional and psychological support, which this reflects, the current situation of the impact of mental health issues during this pandemic. So I think this is all really proven. It really is impacting the mental health of many, if not all. And I think what is so obvious, especially during the first MCO, was how even the normal people, that means the people that, do not have mental health disorders, they too were impacted. So I think, one of the huge, hikmas that has happened throughout this pandemic is now we're able to have the conversation of mental health in a huge way, because now people have at least a glimpse of what or how things like the pandemic can really affect the mental health of individuals. Alhamdulillah.
Definitely. Thank
Yep.
you, Anita. Dini, is there anything you'd like to add first?
Yeah, sorry. So I totally agree with Puan Anita on, after the MCO imposed or during March 2020 last year, many non-essential businesses their operation resulting to the MCO movement, and many businesses has closed down, laid off, and so on. Unemployed increases, and of course, I'm a believer of women empowerment. I believe that women unemployed rising higher than men. So, but the good side of it, I also agree with, Puan Anita, that people have openly shared their struggles in social media, where many organizations like, Miasa, for example, or maybe as I followed many, Dr. Amis, Mida Kami, and so on. There were many organizations started to provide service or help in supporting them. That is what we know in social media. But as Toke is doing a ground job where we where we connect with vulnerable people, like coming from rural area, so they don't know they don't know where they want to seek their help. So it's good to know the awareness is rising. People seeking for help, even in social media, because some face mental abuse at home, some face mental abuse even at work when they're working from home, because, for example, too many for that thing, and well, there are many cases show throughout the year, and it's very frustrating, and it has been very tough for everyone. But let us see the good side of it, and of course, take the good side of it to raise more awareness for it, and also this new norm changing the way we live as a person. Thus, of course, we need to cope with it and supporting each other. That's what for me. Over to you,
Alright,
guys.
thank you. Okay, thank you so much, Dini. Thank you, Puan Anita. I guess definitely, I think the pandemic itself is already very anxious for a lot of people. So the pandemic itself brings a lot of anxiety, like the anxiety of getting COVID, the anxiety of the virus itself, and then the anxiety of the uncertainties that happen with the
Definitely.
pandemic, kan? Yeah, and then we're on lockdown some more, and then there's the first lockdown, and then we're up to the third version of the lockdown, fourth coming soon. So that is even I cannot imagine how depressing that could be for some of us that initially we thought it's nothing, but we never knew if any other cannot actually handle it well. So I think that's very important that but it's very nice to see that more people are addressing this issue, and then a lot of people are just acknowledging that this is a problem, and mental health is also a part of health and not just some myth or anything. So I guess we're all glad that this is finally like a part of the conversation, I would say. So
Yes.
I guess the pandemic is there, and then I'll just talk about lockdown a bit, and maybe this question I'll probably just ask Iman first. Maybe you can give us some take on the youth, and maybe as I understand you're still in university, so maybe you can give kind of like your takes on a university doing online learning and all that. So so how do you think the lockdown is actually affecting the socio-economic well-being of the rakyat? So especially in terms of mental health, but maybe you can share about your end as like a student and a university student struggling with learning, and then there's the whole pandemic and lockdown happening. Yeah.
Okay, yeah, as Shafika has said, I'm a university student, so I'm currently in my final year. And right now we are undergoing our third semester online. And, for some universities, it's been improving the situations where lecturers are more, they are more considerate when it comes to workload because compared to the first semester, everyone was, trying to get to trying to get used to the new conditions. A lot of our assessments were very very burdening, and I myself and my batchmates were all going through burnout by the first week, the second week because we had to go through a lot of assessments and all that. And, like you said earlier, we had to face a lot of uncertainties. So especially, as a final year student, my batchmates as well, we're all struggling to find an internship placement. So right now, it's been quite difficult to find internships because of the MCO conditions. And once they have, announced the total lockdown yesterday, that has, presented a new set of uncertainties. So right now, the whole student body is actually like quite really worried. Like from where can we go from here? Like all the opportunities of the youth are being taken away, not just in terms of being able to socialize with their friends, but the opportunities such as friends who got scholarship going abroad, they have to rethink their decisions, and job opportunities as well for graduates. Once they graduate, like how is the work sector going to be like for them? So there's a lot of uncertainties that we have to face. Like even as the youth, a lot of us are already thinking quite far into our future lah, since our conditions right now is very, very uncertain. Yeah.
Understand? Yeah. Thank you, Iman. I think I'd just like to ask Puan Anita maybe to share with us the severity of like maybe the help needed for at MIASA with the lockdown coming along. Like, is there anything that you can share with us by cases or just an overview of like how if it has become more severe with the lockdowns in place?
Okay. I think definitely in line with what we discussed earlier, how the pandemic has worsened the mental health of many. So obviously in line with that, there has been an increase of people contacting MIASA via calls, via social media, via the bookings and appointments. And in order for us to cater or to support the increasing numbers, we have first and foremost beefed up our crisis team. So in MIASA, we have a crisis team, and we added more volunteers to the crisis team to be able to cater for this. So what our crisis team does is they pick up calls, they go on site. That means if someone is in crisis, in need of help, for example, to bring them to the hospital for their appointments, or bringing food, just bringing them out for a drink, meeting someone to talk to. So this is the role of our crisis team. So they are not necessarily mental health professionals or counselors. They are just trained individuals. A majority of them are people with lived experience. That means individuals who have mental health condition themselves to actually help out. And via and also what we've seen interestingly as well is the younger people. Teens have been reaching out a lot to us via the crisis team, because I think like what Iman was sharing, a lot of technology wise, this is the beauty of social media, right? The beauty of technology. A lot of people teens find it very accessible. They're a lot on social media, so they are able to find us, and alhamdulillah, because of this, they are reaching out for the help. So this is what we're very, very happy about. And although it is quite limited in terms of the help that we can provide, because at the end of the day, we still need parental consent, but it's also very, very saddening, because when the teens reach out to us, they are already at a place where they're suicidal. They're going through extreme depression. They're really struggling, self-harming, etc., etc. So because of that, what we have done at MIASA, we have prepared our modules to help parents to educate them or to provide psychoeducation for them to really understand that, their children or teens are going through mental health distress. So this workshop will be happening June 17th to 19th, and we're really hoping to continue this workshop, as a continuous effort from our side to, educate parents, educate teachers, especially on this, so that, more people are going to be able to, have this help accessible. Because I know that sometimes a lot of teens do reach out to their teachers or to their lecturers, for example, or counselors in school, but they are being somehow dismissed when you don't understand it, when you don't come from a place of empathy and compassion. Maybe the way you convey your words might not necessarily be helpful, because we have to validate what the person is going through. We must hear the person out, and I think this is such an important skill to have as well. Good communication skills, empathy, compassion, understanding, listening to understand rather than listening to advice. So all these things are currently being provided at NIASA, alhamdulillah.
Thank you, Ponita. I think that's very great, especially with providing the knowledge and, for people. It's not just, people who are facing mental health problems. That's already like one that we actually have to talk about, as well as people who are at the receiving end who, I guess in general, mental health issues is still something that is very much vague in Malaysia. So maybe we know it exists, but if it were to happen to people around us, how do we actually
and Shafiq,
how do we, yeah.
It's so interesting that
sorry?
it's so interesting that all of us, especially the mental health NGOs, we went through a quantum leap because we had to migrate our services online. Because remember, during MCO first, during the first lockdown, we're not part of essential service, so we were not able to operate physically, and we have never done anything online in terms of services. So we had to go through that quantum leap, migrate everything online to make that services available. And we conducted or carried out a lot of campaigns online. We did a lot of infographics, and it was amazing and extraordinary, because then we realized that we were able to reach and impact more people via the the whole lockdown from March until April last year. We have been able to conduct more than 130 programs online, reaching more than 500,000 of Malaysians. And if you compare that with a physical program, maximum probably 1,000 people, and that is it. But when you do things online, people can reshare, people can retweet, you can put things on YouTube. So I think it's amazing what we have been able to learn, and the number of people that we have been able to reach. And that is why it has also helped to increase help-seeking behavior. Alhamdulillah.
Also, can I add a bit? In terms of employment, yes, correct that MCO affecting people differently. Some even employed people. I saw in this comment from Mir Sohaimi saying that affecting them differently. They're employed, but they keep anxious doing their work because, firstly, what they have to do is working from home, and also the distraction coming from home, where struggling to balancing out to spending time with their families, and also to spending time with their works and so on. So for the vulnerable groups, for example, as I can take example from PDPR, the education, how do I call it? So the one that we have currently now, which is PDPR, where the students need to learn online from school. Not all families afford to get laptops or any tablets or something else that they need in PDPR, because they then cannot afford to buy it. So that's why the sexual abuse or whatever cases that affecting vulnerable children arising. So talking from what you have done, Puan Anita, it's been really good. I have so many support, like I said just now, spread out online, and it's really good because as for me, I just sometimes I just share on behalf of what I have felt, because I was also one of the a mental health anxiety
Fear.
patient. I need to cope with everything. I need to cope with, struggling on to mix around what I want to work, managing household and so on, helping my mom and so on. So I believe that the vulnerable groups need more assistance in terms of, the government can do some sort of like macam awareness of it, and organization could do some awareness of it, because awareness is just not enough. Giving it is not enough. You need to support and assist them, because they need to understand that during this hard time that we are there for them, coping with them. Because
Yep.
as I said just now, in wait, I have a data from United Nations Population Fund, UNFPA, where they said 60% during the MCO1 has been unemployed in Malaysia, and also most of them are women, which is nearly to 30% of the household are women who is unemployed, which is these numbers are I would say merisaukan, because uh, most we have to, we have to agree that most of women are working hard to supporting their families. So ada yang ibu tunggal and so on. That's why a bit hard for them to cope with all of this, and particularly for mental health. Of course, it's affecting them severely. And I saw that the government starting to give aids like 1.4 million for the mental health program. I just want to know where the 1.4 million going through. Is it to organization like MIASA, or is it through whatever NGOs that they have? Sort of like macam MIASA needs some more help, for the AIDS to support all these mental health patients. So that's all from me, I think.
I think
Thank you.
Bini, if you talk about the special allocation that was announced during the budget last year, the special allocation for mental health, yes, it will be given to NGOs. I think they are in the process of dispersing this funds as we speak. Because during that same press conference that I mentioned earlier, our health minister did touch on it again. Alhamdulillah. So we know that the money is going to the community, and we're very, very happy, because this is the first time ever that a special allocation for mental health is given. So that in itself, we know that, the government realizes this impact, and they are doing something about it.
Which is good.
Which is good. Alhamdulillah. Progress, all in all.
If I may
Thank
add
you.
something.
Thank you. Yeah, sure.
Yeah,
Go ahead,
Puan Anta had mentioned like how, having to convert to online and all of
Yeah.
that. Especially for this pandemic, I think that has been one of the pros among the many cons, because I think once a lot of things, a lot of businesses, a lot of initiatives had to go to convert online, you can see like a lot more efforts and informations are shared. And, as especially among the youth, when we're stuck at home, we're always on the social medias, and we get to access more of this information. And all these NGOs, they're taking this new approach of sharing it through easy to read infographics. So people are more attracted to, want to learn more. And especially with the reshare button, people are just sharing. And I feel like that's one of the biggest pros of, of all of this, a lot of my friends are more informed nowadays, and people are getting to know more about the things that they did not know about.
Yep.
About activism, about the mental health, and so on. So yeah, I feel like that's a big pro as well.
And that they can
Thank you.
actually
Yeah.
do something about it, Iman. Alhamdulillah.
Thank you, Iman, actually for bringing that up, because it actually brings me to my next questions I have to dedicate to Puan Anita first. As Iman has mentioned, basically the usage of technology and how it has improved most of our lives. Kind. So I guess that is a pro without a doubt. But I like this one saying that has been circulating around when the pandemic first started, where what people say, if you're in a problem together, all of us, we're on the same boat. However, when it comes to this pandemic, technically, we're only in the same storm, but not all of us are in the same boat, right? So some of us may be in a better boat, and some can be at a very shipwrecked condition. So I really like that saying, because actually it gives a lot more acknowledgement to those who are actually really struggling. as compared to maybe me who still has a roof on top of me despite everything that's happening, right? So which brings to this question, I would like to ask one Anita. So with the rise of uses of technology, I know it's been helpful for your reach to get all these people who need help and all that, to reach all these people. However, I just want to know also, maybe you can share with all of our friends who are in our life at the moment. So how accessible mental health care is in Malaysia, especially for those in the lower income group. And as we're aware that the B40 group is accounted for the highest number of actually depression cases. So how accessible it is for them, and as of until today, how do they actually, get in touch with you, for all of us who actually don't know? Yeah, if you can share with us.
Yeah. Thank you, Shafika. That's actually a very good question. Okay. Alhamdulillah, in Malaysia, we have about 1,000 health clinics where if you go to a health clinic for the B40, it's about 0, 5, 10 ringgit for them to access this service, right? So you have accessibility at health clinics. But when we talk about mental health services, you are able to access this via government hospitals, for example. You can go to Mentari. Mentari is a community health center. So it sits in the community. There's about 28 Mentaris right now. I think it's 22 full-blown Mentaris. So they operate Monday to Fridays. And then you also have mental health NGOs on the ground. So in terms of accessibility, it is there. However, the challenge is it's the wait time. So for example, you want to go and see a psychiatrist or you want to go for therapy. It is affordable, it's not much of a cost, but it can take up to probably 1, 2, 3 months of wait. So that is the challenge currently. For psychological services, so for example, if someone wants to go for therapy, what we have done at MIASA is we are currently providing all our services at no cost. And the reason for this is we really wanted to break this barrier to access. And for those of you who do not know, and I realize that a lot of people in Malaysia do not know this because this continues to be one of the top FAQs at MIASA, that we are not financially independent. MIASA isn't. So what we have done and how we're able to make this sustainable is we charge all our services for the M40s and T20s. So the money that we get from them, we are able to subsidize for the B40s. And of course, we can't do it, for every single person. So there is going to be a wait, but not as long as, as where you would go to a government hospital, for example. So people the B40 groups have been able to access, be it therapy, be it counseling, be it peer support, be it group, support, art therapy, workshops, our programs, anything that the B40s want to access, they are able to access via MIASA, and our friends, on the ground on other NGOs, they are currently subsidizing their services as well for the B40. So this is the beauty of what has happened, via this pandemic. A lot of people are realizing that, if you come from the B40 group, if you are before the pandemic being left furthest in society, during this pandemic, you are going to be left even further in society. So a lot of people have jumped, and especially NGOs, and I really, really have so high regards of NGOs because they really, really work hard to be able to, ease the burden of the health system, being that link to the government. And I think that sometimes, on the ground, we don't really know what they're doing up there, but as NGOs, because we work together with, the ministry, for example, we are able to relay that message, which is also important because people on the ground must know that the government is doing something about it. Sometimes the information might not reach them. And also this comes with, the beauty of technology again, and even, other forms, for example, radio. We have a program on IKIM, which is called Kembara Shifa. And what we've realized is via a radio program, people in the rural areas are able to access information accessing information in itself can be so helpful and beneficial, especially psychoeducation, because like I think Houdini or Iman was talking about how we, when we talk about mental health, we don't realize it's a medical condition, and we think it's lack of faith, or it's more of kena bomo ke kena sihir, things like that. When in actual fact it is a medical condition. So people in the rural areas, if they are able to access information, then they're able to bring their loved ones for the care and help, because klinik desa ada, klinik kesihatan, health clinics are available for the help. So this is so what I'm trying to say is there are services available for them. It is accessible, not as accessible for M40s and T20s, but we are all working together to ensure that the B40s are getting the help. And one of the other things that a lot of NGOs are doing, including NIASA, is we have last year collaborated with Total Lost Food Project, where we are giving free food, free drinks, free hygiene products to the B40 group. And I'm sure, both of you guys, Iman and Dini, you guys are doing the same, trying as much as possible to make all these things accessible to the B40s. And I think the other group that I really need to highlight are people that are disabled, because due to the lockdown, personal assistance, they weren't able to access personal assistance. Many are bedridden. They're not able to get out and get drinks or food. They don't have work. So this is one group that we really need to highlight. And also, of course, people that are, homeless on the ground, people that are in prisons, people that are in mental institutions. So these are some of the other groups. And of course, the marginalized, the vulnerable groups. So more needs to be done, but very, very happy with the progress and awareness that is currently happening. Very, very much. Alhamdulillah.
Thank you, Puan Anita, especially for sharing with us the whole kind of access that is actually out there, especially for the B40 group. It could also be my first time listening to it, honestly. Okay, maybe I just want to ask Dini on behalf of Toke, since you're handling a social enterprise, right? So I also want to know how the implementation of MCO 3.0 and the coming total lockdown, how has that really affected your social enterprise? It could be both the people behind the social enterprise starting to give aid to the people, and how is it also affecting your beneficiaries as you've seen from the previous lockdowns, and also what are you foreseeing, and then you can maybe share with us what you plan to do and all that.
Thank you so much for the question, Shafika. It's a very good question. I just want to reintroduce back. Toke just launched this February 2021, where it's very newly social enterprise born, even during this pandemic. So I found this opportunity to help those in need, especially youth coming from vulnerable groups, B40 groups in Kuala Pilah, my hometown, and also Seremban, where I live. Because at the moment we can see a lot of NGOs assistance, a lot of social enterprise assistance, like what Puan Anita just mentioned just now, that are coming from especially at KL, Selangor area. I really want to tell you guys that actually in Seremban or even in Kedah ke, in Perlis, Terengganu, whatsoever, the NGO and social enterprise assist is not kind of like how you get in KL and Selangor. That is the real true story. And it's good to know that what Panita said just now, that government has assist, government, some NGOs has assist and so on. But in rural area like this, Negeri Sembilan, or I would say not rural area lah, but specifically in this kind of negeri state, that you don't look at, I'm not saying at KL Selangor, the assistance of government and NGOs, also social enterprise, is needed at this place. So that's why I can see the opportunities of I launch my social enterprise Toke, where specifically on Toke FNB projects, because I said just now, Toke is looking at agro and also FNB. We currently pausing the agro side. We are continuing the FNB services, where we provide fruit from home food, delivering to consumers, as what we have done during this February until February until April. And after we had, Ramadan, we had a project called World Buffet Ramadan that I want to share with you guys of what I have helped my beneficiaries to assist them, to have some pockets money to support their family during Eid al-Fitr. Even though we don't have Eid al-Fitr at all, but always remember that in Islam, of course, we need to always celebrate all that good things after we had Ramadan. And as of course, we're taking break for now, Shafika. We're trying to figure out what's best, but I have figured out with my team on, to continue adapt with the new kind of marketing to sell the F&B product that has been produced by the vulnerable groups, like my beneficiaries coming from youth and mothers. So mothers, not saying that they don't have husband, they do have, but the husband might be affected by not having kerja and so on. So that's why I'm helping them to support their family. So my team and I believe, are currently looking at a scalable product to ensure that even though they coming from, for example, because I'm looking at to helping people in Negeri Sembilan. There are people jauh daripada tempat saya, so they coming from Jempol lah, apa semua lah, so jauh. So I need to think of scalable product that can be sent to them, for example like bakul makanan and so on. So during World Cup last year, we managed to get a donation aids in total of 16,000 ringgit, where we managed to give free foods, free hygienes and free Ideal Fitri aids to the vulnerable groups, and I'm currently taking care of a center called Al Kausar that helping vulnerable children that coming from baby hash in Negeri Sembilan. So the NGO is there, but the assistant is not. So it's good to know that you had that, but people in Negeri Sembilan doesn't have that, because some of the whatever leaders doesn't care about it at all. So that's why the NGO, the social enterprise in Negeri Sembilan that I know right now is currently helping. Also, also when I'm partnering out with Bagibalik movement, where we get sort of money during the first launch, in total of 316 something. So we plan to allocate that money to give some aids to our mothers and young and the youth, the vulnerable, our beneficiaries specifically, to help them, to assist them on this current MCO that has been just announced yesterday. So Shafika, just to let you know, still figuring out to stick on delivery for food and businesses, but currently we don't have any business progressing. But inshallah, on June we're going to start it back, because I just want to give some of times for my beneficiaries to think about to take their time to manage their family, because of course there's so much going on. And I hope that everyone who watching this live today can which is mostly in Negeri Sembilan can support this cause, and your money goes to someone those need help, especially in Seremban, Kuala Perak and Senawang.
Thank you, Bini. Thank you. Especially, with the things that are happening in states that are not Kuala Lumpur and Selangor, maybe most of us are not aware, kan? So thank you so much for that sharing, especially on how it's happening there in Kuala Pilah and Seremban especially. Okay, maybe I just have like a follow-up question, unrelated but somehow related. So this is for Iman, possibly, since you're the branding associate of Putra. I believe I've seen that Putra posts a lot of like infographics on different issues you tackle, because I guess the essence of Putra is to champion rakyat-based issues, social issues, right? So so from a youth perspective, besides that the efforts that you've mentioned, you also had like this community mapping survey that you mentioned earlier before we started. Also, what are some of the efforts that Putra is also doing on behalf of the youth to kind of really help with the passing of information, or just creating awareness on all of the topics? Yeah.
Sorry, I can't hear you.
So can you hear me now?
Okay, yeah. Can you repeat the question?
Okay,
so sorry.
Yeah, just wanted to know from like a youth perspective, how are you and the people at Putra utilizing the platform to really spread on like awareness and information?
Oh, okay. I think like aside from the infographics that we have, there's also an initiative by our research team in Putra where we invite Putra writers to write more on the on issues that they think might benefit the society. So we have the Putra website, and also there's been like the Putra Hub, where we try to seek we try to engage with the community more, and especially with the youth. We try to share what we have, the knowledge that we know, and try to educate them on the assistance that they have, that they can apply to, and so on.
Thanks, Iman. Okay. Also, okay, since we have about like 15 minutes before the Q&A session, so I guess just want to inform to everyone, all of our viewers, we're having a Q&A session at 12. So I think starting at 12, maybe we can go through some of the comments that people leave and we'll just address them together. Also, I guess before, yes, we have 15 minutes left, and maybe just some of my last few questions. I guess I'll first ask Puan Anita, and then Iman and also Dini, you can add on anything. I guess this is something crucial that we should, I guess, ask and talk about. So how do we actually mentally prepare for the pandemic? As seen from the data and like, the numbers of people actually reaching out, I guess not all of the Malaysians are actually mentally prepared for the pandemic, because we've never seen this much of like increase and spike of like increased number in calls and the need of help and all that. So on behalf of MIASA, what are some of the things that we should always have in mind to, really mentally prepare for this current MCO 2.0 and possibly the total lockdown coming along, starting 1st June? And then just if it's not for the lockdown itself, how do we, keep our mental health just well in general?
Yep. Thank you very much, Shafika. It's a very important question, and it's so difficult for me to answer this question because, I'm a person with a mental health condition. So being in this pandemic, it has been challenging even for a person like me, although I have the knowledge, you see. But being MIASA, what I can say is, first, let's not panic. Let's focus on the present. I think that what I've learned, from the stories of my peers, from caregivers, from my own experience is during the first MCO, what was very helpful, because, that was our first time coming into a pandemic. We didn't really understand this virus. And so there was so much fear, that was happening. And then going through a lockdown, although, COVID numbers were only, 100, during the time. Having a schedule really helped, having a routine. Because I think those of you that go through mental health struggles or have mental health disorders were not able to focus well during this period. We feel very demotivated, we're, struggling. And so having a routine or schedule can be helpful. But having this routine or schedule, do not be so rigid about it. Okay, it's just helpful to know, what to plan, what we can do during the day, what we can look forward to the next day, but not to be health and also mental health. That means you've got to sleep well, you've got to rest, have enough sleep, eat good balanced diet, take care of yourself, do things that you like. I think during a lockdown, you will feel very isolated, you will feel lonely, you will also feel very disconnected. So as much as possible, try to connect via online. So that means you can do video calls to your family, you can do video calls to your friends. I think a lot of people have told us that during the pandemic, they have been in touch with, long lost friends. With people overseas, with extended family members. They have even, called their moms more frequently than before. And all these things really, really help. The other thing is, please do exercise if you can. You know, exercising really helps because you really have to sweat. Because if not, we're just on our phones, we're on our laptops. You know, students are, you know, doing online classes. People are working from home. So where is that sweat? You know, you've got to calm your nerves. You have to keep your body moving. Sometimes, in order for you to, you know, to relax, don't focus so much on up here, but focus on your body. That can also be very, very helpful. Doing things that you like could be spending time with families, watching movies together, playing games, doing barbecue, for example. You know, all these things can be very, very helpful. And take a break from social media, take a break from the news, you know, and then try to read from reliable sources. I think this is so important because so many things, you know, there's overload of information right now on social media. You know, we just continue to share and share, kan, Iman? Tapi, you know, accurate information is so important, especially when there's so much fear and panic that is, you know, going around. So all in all is investing on all these things on a daily basis. You know, this would really, really help for us to all manage, you know, what is going on, especially with the rocketing numbers of COVID-19 right now, you know, with, you know, a lot of people, losing lives, you know, mortality is really high as well. People are dying because of COVID-19. And I think one of the things that I would also like to highlight, interestingly, is we haven't really, you know, spoken a lot about the other NCDs, on how, you know, those that are having NCDs, how it links to, you know, the immune system, and how these people are more vulnerable to COVID-19, and the risk involved. And I think this is a different lens that we also need, you know, to be talking about. So the socioeconomic factors are something that we really need to look upon, because if not, when there's a higher risk, more people get NCD. When more people get NCD, then a lot of people, you know, can be really affected with the complications of getting COVID-19 as well. So a lot of things, Shafiqa, that has, I think, been we're able to highlight because of this pandemic, COVID-19, and the parallel pandemic, of course, the pandemic of mental health. So a lot of interventions. Very, very happy that now the discussion of mental health is included on a daily basis. I'm very, very happy to see youth and youth movements very proactive in engaging with the public on this, talking about it openly. I think it's very, very helpful, especially if we all know that half of all mental health conditions begin at the age of 14. So very, very prevalent in this age group. So this discussion needs to happen more. And again, like I say, very happy with the progress that is happening.
Thank you, Pananita, especially with sharing. I guess it sounds like the basics kan, but not
Betul.
everybody can, you know, really practice it in with a lot of
Yes.
things going on, Rohit kan.
Betul.
Yeah.
Betul. We all know it, but we need the reminders.
Yeah.
We're only human.
Yeah.
We're only human. You know, we talk about please social distance, you know, please wear your mask, and people still don't do that. Please be responsible. Please don't be selfish. Adhere to SOPs. If you wear the pink band, don't go around. Don't go to malls. You know, these are something that everyone knows, but we don't necessarily follow this. So the messages it has to be repeated over and over again.
I actually
Okay.
agree a lot with Puan Anita on, you know, how to manage your stress, especially with students nowadays, with online distance learning. You're spending around 8 hours
Yep.
you know, on screen, and that doesn't include the pre-recorded lectures you have to watch, the readings you have to read later. So it's actually quite a lot. And one of the other cons that we have to face, you know, as a student as well, is also screen fatigue. Like, the pros of social media is one thing, you know, you get more access to data, more access to new information and updates. But the other cons that we have to go through is screen fatigue. Like Juanita has mentioned, you know, all the influx of information, the new things that we are constantly learning and unlearning and learning again. It's actually quite taxing. And as someone who is very reliant on having friends around as a coping mechanism, being alone because of the COVID-19 MCO and all that, being in isolation, it's been really difficult. So
Yep.
calling your friends. I call my friends every night. Every time when it gets a bit hard, I call them. I try to get in contact with anyone I can. I make sure that I have some time to myself, take some time off. Like recently, I took around almost 2 weeks off of social media because, I really needed a break. There wasn't any bullying or anything, but I just
Right.
really thought that I need some time to deal with what I already have on my plate right now. Dealing with classes, dealing with tutorials, reviews that I have to do, it's quite a lot. So having a schedule like Pananita has suggested is really, really essential. It's really crucial and it will definitely help you. So planning and, having friends around through calls, especially since, if we don't have Skype or whatever, then we have calls. We can just call, free call. So I think like that's really important as well. Try to seek out any kind of support that we can and, properly manage our time well.
Thanks, Iman. I guess like both you and also Ponita has mentioned is honestly the little things. Tapi when we're so saturated with all this, anxieties and of the uncertainties, you kind of cannot get your head straight. Um, okay. Dini's back. Maybe she had like a little technical area there. That's okay. So we were just talking about how on behalf of Miasa, macam how can we actually handle and cope. Tapi us as just individuals and just as a normal human being, how are all of us also coping as well? Okay, I think we just have 4 more minutes left. However, I have this like um timer on the top of my screen saying that there's like 40 seconds left. But just in case we got cut off, I will re-invite all of you again for a Q&A session, just in case that happens. Okay, so I think Dini, maybe you just want to add like building on just Iman was mentioning how she is coping with mental health and how she's prepping as a young person, as a youth, and then Poneta was sharing about the basics, what is usually introduced when we want to try to cope with anxiety and depression. Maybe you also want to, share with us what have you been telling your beneficiaries how to cope and how you have been practicing yourself juga.
I agree with, thank you so much for the question, Shafika. I agree with what Anita just now
And then Ponita was sharing about the basics, what is usually introduced when we want to try to cope with anxiety and depression. Maybe you also want to, share with us what have you been telling your beneficiaries how to cope and how you have been practicing yourself juga.
I agree with, thank you so much for the question, Shafika. I agree with what Anita just now
And then Puan Anita was sharing about the basics, you know, what we usually introduce when we want to try to cope with anxiety and depression. Maybe you also to, you know, share with us what have you been through, how to cope and how you have been practicing yourself juga.
Thank you so much for the question, Shafika. I agree with what Anita just now